joining us via Skype from Kano. Dr. Tijani, can you hear me?
Good morning. I can hear you.
All right. So, how are you? How is the state handling the challenges? I mean, the other day, the NMA did talk about the unfortunate incident, and then 70% of doctors, we understand, are not showing up because they say they've got no PPEs to work with in Kano. What's going on?
Good morning once more. Yes, we have reports of some doctors.
Yeah, go ahead.
Please, yes, we have reports of some doctors, nurses, healthcare professionals getting infected, and that's national news. However, we have moved into action and ensure that no health worker is getting any infection. We have, within the last few days, distributed personal protective equipment to all our health facilities, in addition to what we have provided them before. We are also currently training them on infection prevention and control, and also how to identify and ensure that people they are coming in contact with do not have signs and symptoms of COVID-19. This, we believe, if we continue to do this, which I've been doing anyway, that we are going to reduce the rate of infection amongst healthcare professionals.
Healthcare professionals, do you have a comprehensive list of the health workers in Kano, all the healthcare givers? Do you have a comprehensive list, and do you have enough for every single one of them?
Yes, we have a list of healthcare professionals and healthcare providers in Kano. However, we deal with hospitals, we deal with facilities, both public and private health facilities. We supply health facilities with IPC materials, that is infection prevention and control materials, so that they can be used in these facilities on daily basis. We don't deal with individual health professionals.
All right, let's get back to Dr. Omar. I believe you can hear me now. Dr. Omar, can you hear me? I'm asking, tell us about the comments coming through from Johesu in Kano. What's happening?
The whole situation is so bad that we have to grapple with the fact that we are not immune to this disease, and we have to come to work. We have to contemplate being infected, and all of a sudden, in just a space of some few days now, we are counting a lot of our members that are infected. And the issue of PPEs, we know the government is trying, but the PPEs, because of inadequacy, are given to selected healthcare professionals. But we always argue that if you give overall this PPE overall to only nurses, they always, if they are treating patients, they come out and they meet other healthcare workers in the corridor or somewhere in the hospitals, and they get infected too. So our main issue is, we have been hearing in the news about these donations by the Otedolas, the Alakijas, the Ongotes, the Boas, and we have not really seen the money in our hospitals. Somebody has said the value of money is in its use. So I know there are so many explanations. The money is not only for medical supplies to hospitals, it's also for palliatives, which is good. But I believe priority should be given to medical facilities where we can, everybody from the cleaner to the security to the driver, everybody gets what maximally can protect them from getting infected. Because as you know, we have limited number of healthcare professionals in the country, and we can't afford to allow them to be infected and be taken to isolation where we allow our people to be dying.
Dr. Ma, let me jump in and ask you this. When you say that they are being given to selected people, What do you mean?
Because, of course, they're in short supply. So you can imagine if we are told that these overalls, where you cover your body, not only the mask and the hand gloves and the overall, I'm talking about the complete PPE, is only given to those people that directly have contact with the patient. But then, if you say so, you are also exposing other colleagues that do not wear that in the same environment. Like I said, a nurse can wear this PPE and has to come out to look for something in the same clinic. Maybe she meets a lab scientist that is not wearing. And we know this disease is an evolving disease. Up till now, nobody can tell you exactly how people are getting infected. We are just relying on the information we know about similar diseases caused by this virus. So we are saying, despite our effort to protect ourselves, we are still getting our people being infected, and we can't explain why. You can
Dr. Hussaini just said that they don't deal with individual doctors. Are you suggesting that that strategy should change?
Of course, because if I have 20 healthcare professionals in AKTH, I should also consider the number. If I am only looking at the facility, I should consider the number of people that are working there. If I say I'm only giving 2 pieces of items to AKTH while I know I have 20 personnel there, then I'm not doing the right thing in my opinion.
No, well, let me bring him in. Dr. Hussaini, haven't seen the results, the outcome, the unfortunate deaths recorded by medical workers now. Don't you think that your committee, or the state government, should actually sit back and reevaluate the method that you've been adopting? Because he just said now that he thinks it should change.
Yes, I think I need to make this clarification. PPE is a whole range of items. It ranges from just goggles, face masks, which can be medical or N95 respirator. It can be the coverall, heavy-duty gloves, surgical gloves, boots, etc., etc. So it should be understood that it's not every healthcare professional that needs the complete set. Some would only require hand gloves and face mask, while others who deal with patients who are infected might have to use the complete overall. And this needs to be made clear. And what healthcare professionals need to understand is that even a safe distance with a suspected case could actually protect someone from getting infected. So there are dual ways of doing this thing. Healthcare professional himself protecting himself while at the same time providing him with the necessary equipment. This is this. On this change of strategy of how we deal with healthcare professionals, I think the best way is for us to deal with facilities, and then facilities deal with healthcare professionals. Otherwise, we'll have like 1,000 people to deal with individually, and that will become chaotic and logistically impossible. Remember, we are in a pandemic. Apart from health professionals, we also deal with a lot of other issues, which if we are not very well organized, we may run into chaos and our response may not be effective. Remember that we are getting this response on track, and we need to streamline and ensure that every pillar, every single item on the response is taken care of and also is very well organized.
So, Dr. Hussaini, in other words, are you saying that you're not going to change the strategy which you're currently employing? Is that what you're saying?
What I'm saying is, yes, if there is need for change, yes, we are going to change. We are not fixed. However, we need to look at it from the logistic part. We can deal with over 1,000, 3,000, 10,000 individuals as individuals. So the best way to deal with this large number of people to deal with their organization, I supply a hospital with a PPE, and then the hospital itself then gets organized with it in a smaller group. Otherwise, the system will become chaotic if people come to pull materials, personal protective equipment individually from the committee.
All right, I understand that. But then when you say you supply them, are they supplied enough PPE?
Yes, we supply these facilities based on their consumption, and we feel it's enough. And we ensure that each hospital is supplied with what it needs.
Right, because we're looking at a case where dozens of health workers have been infected in just, few weeks. And this is Kano that in quote came late compared to other states like Lagos. And you have dozens of health workers being infected. I want to believe you're concerned, but in terms of the strategy you're employing, are you confident that it will reduce this dangerous trend?
Yes, we are very confident. For the last 5 days, we have been training healthcare professionals on how to use the PPE. It's one thing supplying a healthcare professional with a PPE, but it's another thing to use it appropriately. I can give someone a PPE, but again, in the process of removing it, which is more critical, he could get infected. So we are trying to show and teach our healthcare professionals how to use the PPE, how to put it on, how to put it off, so that they can be able to protect themselves. It's beyond just supplying, but it means we need to get people appropriately trained to ensure that they know how to use these personal protective equipments.
Speak with the chairman of JHESU, Dr. Omar, about this training and the capacity of health workers in Kano. So, Dr. Omar, how well trained on one hand are your members, and do you have adequate members spread across? Because I recall that the PTF was even saying they're trying to train people to contact trace. So in that area, there seems to be some inadequacy. So for you, do you have adequate workforce?
Of course, we don't have adequate workforce, and you just like Dr. Tijani said, the training just started within the crisis, and it shows that we are not prepared for this kind of situation, because you need to have trained this personnel a long time ago. I just received information yesterday that the training has been going on for just the last 2 days. And even though it's a welcome information, but we feel this should have come a lot earlier than now, because when you are in a crisis, you are disorganized. There are likely chance that what you want to dish out is not going to be beneficial to people. But we are happy that our members are benefiting from the training. But like I said, this disease is a novel disease. You can see from the statistics, even the US, in Spain, in Italy, like there are 20% of cases that health workers are infected. So you see, despite the training, despite the PPE, still the health workers get infected. So what of more if you remember in US and Spain, you see even ambulance drivers wearing complete PPE with overalls, because they are transporting healthcare workers to other places and transporting sometimes some patients. So you see everybody is exposed. I know the state coordination team is doing their best, but they can only do what they have. So my concern is from the federal government. Why not all these monies we are getting for donations, and by the way, we have to thank these people for giving this donation, but why not put this money in the system so that we see these PPEs available for everybody, so that we protect our members?
Question that Dr. Hussaini responded to the other time about the sufficiency or otherwise of the PPEs. He says that the PPEs are sufficient for the centers to which they have been distributed. Do you agree with him?
No, I can't agree in totality because, like I told you, we can say yes, we have some measure of adequacy of some items of what we need. But like I told you, some of our members that need complete overall PPE are not given because of the fact that it is felt that they don't have direct contact with the patients.
But you also heard him say the other time, Dr. Umar, you heard him say that it's not every health worker that needs the complete overall. He says some just need face masks and hand gloves and the rest of that. And so in specific terms, how many of those complete overalls would be enough? And then those, hand gloves and all with other people, other health workers, other levels of health workers, how many of them do you really need and how many do you have at the moment?
Well, I don't have that information for how many we have on ground, but I know we have been given face masks and some of the items and even the PPEs. But I can tell you in the last just few days or few weeks, we had to try to calm our members because the PPEs were not available because some of them were threatening to down tool. And even now there are some sections of the workers that are not working in the hospital because they feel they are not well protected. So this shows that still we have some inadequacies in some of the items. I understand the scarcity is everywhere globally, but I mean, if we have money, we have this kind of money, that is my point. If you have this kind of donations, why not source for these items? Remember, these items are disposable items. You don't use them for, if I am giving one mask, I'm not expected to use it for 1 week or 10 days, or these are something that I use and then discard.
Okay. Let me take this back to Dr. Hussaini. You've heard the chairman of Johesu say that they do not have sufficient PPEs, whether the overall or even the other ones. How do you respond to that?
Yes, I think there is, we need to separate wants and needs. For us at state level, and also from what we have been providing health facilities, we have adequate numbers of the PPEs, and we've provided these hospitals, these facilities with a number of PPEs. And like I said, healthcare professionals need to understand this. Yes, ambulance driver could have complete PPE if he's conveying a patient because he is in direct contact with a patient. However, health workers might not require the complete PPE as we see them on TV. Some would require only hand gloves. I need to reiterate this: hand gloves, a face mask, and hand sanitizer for them to interact with clients, with individuals that are suspected cases, and they should maintain a safe distance while interacting with their clients. And this is what they need. Others who are in direct contact with patients would require the complete PPE, and we've been providing that to all our health facilities and in adequate numbers. For me, I will implore the Johesu also to continue to sensitize their members about what is the appropriate PPE for each level. Each level has a number of personal protective equipment that it needs, and that has to be that has to be followed. Otherwise, the number of PPE, if we are to provide each and every individual health worker with a complete PPE, we might not be able to sustain. Remember, just like he's rightly mentioned, globally there is shortages of this PPE.
Dr. Hussaini, really, it's a very tricky one, we know, but we expect that those health workers are protected while they go on the job they do. But just before we wind down on this conversation, I'd like to get an update. I recall that the PTF visited Kano, and those deaths in Kano were said to be perhaps as a result of COVID-19. But the Minister of Health at the House of Reps recently said that, well, there is no conclusion of sorts. Is there an update as to the cause of those deaths? Because it seems we take 2 steps forward and 3 steps back and we're back to square one. Is there an update on that?
I think we are 2 steps forward. We are moving forward to ensure that we've concluded. What we are doing, the verbal autopsy, is a painstaking process that we don't want to rush and give conclusion without ensuring that the data, the information we are giving to the public is authentic and is correct and is accurate. So the general public would have to bear with us. We are going to conclude this and in a very short while, and we inform the public on what are the causes of death.
There are some who have criticized the state government concerning easing the lockdown and the challenges that was going on. Okay, you know what? Let's go to break. We'll come back and let you respond in just a moment. Stay with us. Welcome back. Well, Dr. Hosseini, we're winding down with you now. You know, while Kano recorded those unfortunate deaths and they're still trying to get to the bottom of it. So in the midst of that, there were still figures, huge concern about what was happening in Kano. But in the midst of all of that, at some point, Kano did relax the lockdown. So could you explain, for those who couldn't understand it, why did that happen? And is there still going to, I mean, is the state government still considering easing the lockdown at some point and then bringing it back?
Yes, I said one of the principles Kano government is employing is that it allows people to go and restock their items so that... Do you hear me?
Go ahead.
Yes. What we are doing in Kano is allowing people to go and restock, get essential commodities so that the lockdown period is not again harsh. You know, you are restricting people from movement, you are restricting people from getting essential commodities. So the strategy Kano government is taking is easing the lockdown twice in a week, from 10 o'clock in the morning to 4 o'clock in the to 2 o'clock in the afternoon, so that people can restock. And people need to survive, people need to eat, people need to have essential commodities. And this is in a way to ease the lockdown, the effect of the lockdown, especially the harsh condition people are in. Remember, a lot of people in Kano are relying on what to feed daily. And if you sustain this lockdown, you might encounter breakdown of law and order if you do not employ these strategies. Okay, so respond to this as short as possible as you can. Yes, we've heard that, Dr. Musa was talking about the funds that have been donated. They want to have access so that the authorities can equally, in turn, utilize them to provide materials for the health workers. Is Kano State government just waiting for those materials to come in, or what is Kano State doing to provide for several other people before these other funds come? And then information about the grains that were sent to the states, have they all gotten to the appropriate quarters? On the grains, I'm not in position to say, since I'm not the committee chairman for palliative, so that I'm not competent to comment. However, since the beginning of this pandemic in Kano, Kano State government has been doing its best. It has 2 isolation facilities and is fully funded by Kano State government. We have been feeding patients and those who are involved in response. We have been providing transportation. We've been paying allowances for healthcare professionals. We've been buying PPEs. We have been doing so many other things in this response. And this is solely done by Kano State government. I don't know whether the money, the funding from Presidential Task Force or from Abuja has arrived Kano. But what I know is that Kano State government is shouldering a lot of responsibility. Most of what people see in Kano happening is actually with the funds of Kano State government.
Dr. Tijani Hosseini, Coordinator, Rapid Response on COVID-19 for Kano State. Thank you for your time this morning. Let me switch to Dr. Umar. Well, some of the release that you sent out yesterday indicated that 168 persons in AKTH were exposed, the medical workers, and 25 happened to have tested negative. Could you shed some light on that? Were those equally exposed, and how did they manage to test positive? Could it be that their immune system or did they have contact? What was the exact scenario?
No, the contact is in level of contact is differs from one person to the other. So, and I believe there is also some level of luck, even though it may not be scientific, but you know, if a patient has contact with the lab scientist, the pharmacist, the nurse, and then one of them turn out negative and the two turn out to be positive, maybe you don't have explanation for that, but I believe those that tested positive must have had enough contact with the patients, because we had several patients that we treated without knowing they were going to turn out positive, and they eventually turned out positive. So they have gone to see almost all sectors of healthcare workers. A patient was even admitted into ICU for a long time. Eventually she died, and a lot of people were exposed. So, and these numbers I gave you, there are even some that are still waiting their results. So they are not still out of the woods. They are still waiting for their results. So we are still praying for them to be negative too.
Just on a final note, we talked about the deaths in Kano that has gotten a lot of people worried. I mean, they're wondering how that happened. And we understand that, yes, verbal autopsy is ongoing. I want to believe that some of your members are involved in this. Just how hard is this process? How tedious is it? And how can we rely on whatever comes out of that process as maybe an indication of what exactly really happened?
Yeah, the verbal autopsy is going on, and I am not part of the team that is conducting it. But this is my personal opinion. There is no way we can separate this death with COVID-19. Because as we know, I personally undertook some small studies. There are so many people that reported death. But these deaths we see, they are from elderly people. And we are well aware of what COVID-19 does to elderly people, especially if they have comorbidities, they have underlying conditions. And this is what we see. So people argue that it's natural death, but we know natural death cut across all ages. And if you say because COVID-19 has caused shutdown of many health facilities, access has reduced, then we should also see death among other age groups. Why are we only seeing in elderly people? This is my personal opinion, and I still believe this death have to be linked to COVID-19.
All right, one more thing. What is the mood? How are your workers, your members, your colleagues? What's the mood in AKTH now for the professional workers and everybody else?
I can tell you some have their upbeat, but a lot of our workers are not so much worried about themselves as they are to their families. Because currently I have a colleague that tested positive. She's a lady, and she's lucky none of her immediate family members tested positive, and she's in isolation. So even after testing negative, the husband and the children have to self-isolate in the house. And now the husband is the only one doing the chores in the house. And who's going to pay for that? So these guys, they are vulnerable. The families of the healthcare workers, they are just innocently unlucky to be married to these guys. And they are exposed. And remember, these our members have been withheld their salaries from last 2 years when they went on strike. And we just want the government to be fair to every worker, to the healthcare workers, because recently, as we were on strike for non-alliance to IPs, but even without asking the president, as directed, they paid their salaries of January and February. But JSU members have been asking for their withheld salaries from last 2 years. Up till now, they have not paid. I'm happy the president has mentioned the family members when he was making his speech, that the government is going to support them. So I hope now this is the time to walk the talk. This is the time because they got the pinch last 2 years when their spouses' salaries were withheld for 2 months. This is the time, and I believe I agree that we have a compassionate president. I believe this is the time for him to direct that payment immediately the withheld salaries of April and May in 2018.
All right, Dr. Murtala Umar, Chairman of Johesu, Kano State. We do thank you for talking to us this morning. We wish you, your colleagues, and everybody else that well. We hope that everyone comes out safe. Thank you for talking to us.
Thank you. It's my pleasure.